Good morning and good afternoon, everyone. Thank you all for taking your time to join the Cyber Warriors Conclave Saudi Arabia edition. Today, we are connecting with the senior executives and experts responsible for protecting their company's health infrastructures with innovative solution providers and information security experts. We will learn from them on how to protect and defend our business from cyber attacks during interactive panels and fast track discussions. Thank you to our sponsors, FireEye and Network Perception. The conclave will start off with a presentation on protecting the cyberspace for those who strive to protect our health by FireEye, followed by a panel discussion on protecting the confidentiality, integrity, and availability of information with panelists from International Medical Center, Soliman Fakeeh Hospital, the Council of Cooperative Health Insurance, and the consultant from DHI, WHO, NHIC, and SHC, and also the assistant professor for KSU, followed by another panel discussion on cyber attacks in the healthcare industry with panelists from the Ministry of National Guard Health Affairs, Makkah Healthcare Cluster, Aster Sanad, and Rafada Health Cooperative Society. I would now like to call upon Mr. Jamil Abu Akil, the Director for Systems Engineering from FireEye. Over to you, Jamil. You can share your screen and switch on your camera now.
Thank you, Karen. You can see my screen.
Yes, we can see you and we can hear you. You can go ahead.
Okay. Thank you very much for the opportunity, Karen. It's a pleasure to be with the esteemed and distinguished, our team and our colleagues from the healthcare sector. The healthcare industry, as we see and as we see for the foreseeable future, and as we saw last year, will likely continue to face cyber threats due to its potentially valuable access to research, manufacturing data, and the massive amounts of personally identifiable information, along with other sensitive information. Some of the contributing factors to that make us anticipate that the influence of the threat activity will increase towards this sector are first and foremost the race towards digitization as a strategic direction for the kingdom. And this definitely includes, everything from medical health records, the increasing connectivity of medical devices, which will likely, unfortunately, but likely increase the attack surfaces for your sector, making this industry, the healthcare industry, one of the most vulnerable to threat actors. Another thing to consider is the technological and medical innovations that will likely increase the threat activity from attack groups because they are seeking to obtain this
Sorry to interrupt. Please share your slides.
Just a second. Yeah, can you see it now?
Yes, we can see it now. Thank you.
Apologies for that. So the second aspect that we were talking about is the technical and medical innovations that are happening, which is a lucrative or a compelling target for attackers who want to get their hands on this technology. Another thing to consider is that some countries are putting a lot of effort to improve the healthcare services and products for their residents, making this, a strategic target for state-sponsored attacks or state-sponsored, kind of revenge when a country wants to, prove a certain point or obtain a certain target from another country. Now, M-Trends, the Mandiant Cyber Trends Report, is an annual publication from FireEye. It contains timely data and insights based on the frontline investigations that we get from high-impact cyber attacks and the remediations that we do for them. Based on the analysis we had over the last 5 years, we have seen that the healthcare and financial sectors have taken, the same position, the third position in the year 2020. And if you look at the healthcare segment, it was around 8th as a target in the previous year. So with all the funding, usually attackers and usually the criminals, the hackers, they go for where they go for the money. They look where the money is and they aim for the money. And in a year of COVID and in a year of pandemic, a lot of resources, IT, money, effort, people were, geared towards the healthcare sector. And that's why we see a huge increase of targeted attacks and, cyber attacks on that particular sector. Looking at another important KPI that we have been observing over the years, something that we call the dwell time. Dwell time is basically calculated as the number of days that an attacker is present in the victim environment before they are detected and action, starts to happen. And we see that for EMEA, which is for our region, Europe, Middle East, and Africa, the average dwell time was about 66 days for our region, meaning that an attacker on average spent 66 days inside a customer's environment or an organization's environment before they were detected, and they did, God only knows what they did in those 66 days before they got caught. A very important thing, because we will talk today a lot about ransomware being one of the top threats that are targeting this sector along with other sectors. The cost of ransomware has been over the last few years way higher than the cost of payment card theft. So ransomware has been, doing a lot of damage, a lot of bad things to our organizations that were, that cost much higher than the cost of actual loss of credit cards and, payment cards. This is the, a general trend or a general view of what were, the some of the highlights or the general trends that we saw in the last year, in 2020. Now, in the last few days, leading up to this event, we were working as a team in FireEye to collect some of the most interesting news related to the healthcare industry from a cybersecurity perspective. And, we categorized them, or we classified them into 4 main categories. So there was, I'm sure you've heard of it. Last month, there was a big attack on the Irish health service, okay, where ransomware, again, back to the topic of ransomware, a known ransomware group was responsible for causing massive disruption to the Irish healthcare system. This ransomware group was reportedly asking for $20 million to give back tools that will decrypt the information and restore the services. Then for some, to add confusion to the confusion they created, they decided to unexpectedly gift the recovery tool to the, government for free. Now, the Irish government became more weary and more suspicious of, if you're giving it to me for free, why did you do it in the first place? And they are, first of all, currently very busy with their, partners and supporting vendors and so on, analyzing or investigating this tool, because they're suspecting that this tool may add, more damage to the damage that was already inflicted. Now, some of the results, just for you to know, some of the implications or the damage that was done was hospitals canceling outpatient visits. A maternity hospital also mentioned significant disruptions. Even criminals unfortunately have no conscience. They can do whatever they can do because simply they can do it. A hospital children had significant delays, and all virtual online appointments had been cancelled, and so on. So you can imagine how much damage was done to a big whole country because of such a ransomware attack. We also went, into different, sections in the news, and we were looking for data leaks and data leaks examples. And I found, several examples. Some from, for Dutch citizens, some from the national healthcare system in the UK, and others. Interestingly, I found that, a database that holds information for 7.4 million Italian citizens was leaked. We have seen in the dark web some hackers negotiating a database in Indonesia. Okay, the database holds information for 600,000 citizens. 600,000 citizens, and they give samples of the fields they have from this database, and the fields that they were sharing contained the doctor information, the treatment you get, your email, the user ID to the system, the password, gender, age, address, the device name that you are logging in from, the application version, the OS version on your device, your mobile number, the mobile carrier, last login, and you name it. And all of this for 600,000 citizens. The initial price that was requested was $300. The example I gave about Italy for the 7.4 million, vaccination data, that hacker mentioned that he is going to sell the database only twice because they don't want to be tracked back, or they don't want, they know their business, they know that they should not be visible too much. So they said that they will only sell it twice. People were coming asking to buy it, and they were saying, no, we are already negotiating with 2 other parties. We will finish with them. If they buy, khalas, we're done. If not, we'll come back to you. Business professionals, doing, the standard form of business. And they are, by the way, they are very committed. They will even give you technical support. When they give you the tool, they will give you technical support. Why? Because they want to keep their reputation. They want to keep selling the information they steal from other people, and they want people to pay. So they have to maintain that reputation for them, to keep the money flowing. And like any other business, they accept, any kind of payment that you have. You want to pay through PayPal, through Bitcoin, whatever it is, they're happy to take it as long as it has value. Another interesting thing that we have seen is we have all seen and heard of, the need for the vaccination certificates. And we have seen some Russian, groups promoting vaccination for Sputnik, their vaccine, for a certain price. The cost was, funny enough, the cost was $135 if you are getting one, if you are getting 3 or more, you pay 95 instead of 135. They give you a discount. And that was needed because we need to understand, the need for it in Russia. In Russia, the government mandates that you get the, one of the local vaccines there. So there was a need in the market for people who do not want to take that vaccine and who wants to travel. Okay, so this certificate shows with the barcode. This certificate shows, unfortunately, it's in Russian, shows that you've got the first jab of the vaccine and that you have, you took it more than 20 days ago. So you can travel outside and you can go and get the vaccine wherever you want. Another very interesting thing is a smaller market for people who are happy and prepared to give you a negative PCR certificate. And it can go for as little, the one that you have here on screen is for $25. There are ones that can go as little as $12. Okay, of course, the quality and the, authenticity of the certificate varies. So these are just, some of the very recent, by the way, all of these are very recent. Some of the very recent things that we have seen in the news pertaining to the healthcare sector. Now, if you want to think and ask, why healthcare? Why are people hacking and attacking healthcare sector? We need to look at this from, from 3 different angles. Now, if you watch, crime movies, you will see that what they call criminologists, when they are investigating a crime, they always look for 3 things: motive, means, opportunity. And in the same way, these criminals in the cyberspace will need to do the same. Now, for them, from a motive perspective, people attack the healthcare sector for hacktivism. They want to prove a point. I want to prove something against a specific government. I struck your database. I encrypted all your records. Well, I gave you the decryption key for free. For example, like this case that we are seeing, that is still under investigation. We don't know yet, but as an example, I just want to prove something to someone that I can do something. Information operation, especially in the healthcare sector, there is a lot of valuable, information from, intellectual property, patient information, personal information, lots of things, payment card information, because the health sector also processes money and, payment cards and so on. State-sponsored attacks or financial attacks for people who are, common thieves, just targeting to steal some money. You will see here that we look at 2 things: the frequency of attacks and the magnitude of the attack. How bad will the attack, impact us if it happens? And we can tell that, as usual, financially motivated people, of course, their attacks are more frequent, and the damage they cause because of ransomware attacks has been significant. So this is, a small view about the motive for the people doing attacks. The means, the weapon are many. Just to give you an example, only in May 2021, there's an entity in the US, the Cybersecurity Agency, the US Cybersecurity Agency. They disclose the vulnerabilities that are related to industrial control systems and medical devices. And only in May, we had 19 critical vulnerabilities out there for systems that are ICS systems and medical devices. And this is available for free. You can go into the portal, the CISA portal, and check an updated list of vulnerabilities for these devices. So these can be used, the tools that we use to protect ourselves and to make our lives easier, are being used by attackers to attack us as a weapon against us. That's why we have to secure them and make sure that they are, locked to configured well and secured. Looking at the, the target and source geography, you wouldn't be too much surprised. Our world is, because of politics or economies and many things, is already polarized. Everybody has the opportunity to attack everybody in the cyberspace. An email with a phishing link, a network attack, whatever it is, an attack against cloud assets, are all now easily doable and easily accessible for everyone. So the opportunity is there. So we know the motive, we know the means, some of the means, and we know that there is always an opportunity, and that the world is already, like I said, polarized and waiting for a problem to happen. Now, it is very important for us to know our enemies, for us to defend ourselves. The enemy knows a lot about me. If I'm a hospital, I may have an app, I have a website, people can come in, come out to the hospital anytime. So there is a lot of opportunity for people to gather information, for attackers to gather informations about me. And I need equally as much information about those attackers to protect myself and to protect my assets. We can see that looking at the healthcare sector, which is a big sector, we see that most of the attacks are coming towards directly healthcare facilities, followed by healthcare providers, medical equipment and suppliers, biotechnology companies, and so on. So this is just, a distribution inside the medical sector, or inside, the healthcare sector, of where are the attacks are going inside that sector. These are the top threat actors that are attacking that sector. For example, Fin7 is a financially motivated group that has, broad capabilities, and that is operating all over the world, targeting mainly point-of-sale systems. That's why it is financial. It's called financial, or attributed to financial, gains. Plus, it uses a lot of, ransomware for conventional or traditional extortion. We have seen evidence that this group has been working as early as 2014, accumulating, experience, resources, and so on. This group has been, mainly seen working in the region, working out of the region of Commonwealth of Independent States that contains Russia and some countries around it. Just very quickly, APT 29, another known group that has been working also for many years now. Historically, it was seen targeting Western governments or governments affiliated with Western governments, targeting government contractors, policymakers, universities, health services, and so on. APT 41, an interesting group, very resourceful, very active, especially in this region, very active in the region. We believe that it is a Chinese state-sponsored espionage group, looking after, collecting information or doing jobs for other entities that pay them. Just a small note here, one very interesting thing that I remembered when I saw this group is uncategorized yet. That's why we call it UNC 2053. This group is known to use two kinds of PDF files. One is called annual bonus review, or the other is called company meeting. Now, personally, when I see a PDF file coming to me with the word annual bonus review, I would find it hard not to open the file. And this group, is known for using that file. Company meeting, I can open it, may or may not, but they play on certain things that they know people are sensitive for, and they know that people, will definitely click to get that information. The top malware families we've seen, we'll share this with you, but some just for you to know, some of these are known malware families. And last but not least here, I want to tell you about the top vulnerabilities that they have been seeing, that they have been using. And unfortunately, a lot of them are old. So these are vulnerabilities that were announced or published 2019, 14, 19, March 2020, October 2018. And all of them are patched. And by the way, this is as of now. So this report is very recent. So today, in June 2021, these are the top CVEs that attackers are using to target the healthcare sector. So we still have a very big job to do with patching. It's a old new thing that has been going on for years. We still not properly addressed and not solved. Very quickly, I just want to show you, when it comes, if you want to zoom into the kingdom, zoom into Saudi, FireEye has come with a cyber threat score for countries. In 2020, Saudi Arabia was third globally in terms of the number of cyber attacks and threats.
We're just running short of time.
Yeah, sure.
This is my panel in 1 minute.
Yeah, my last slide. And in 2021, so far, attackers have been focusing elsewhere. So, but Saudi is still amongst the top countries on the list. And with that, I hope that this briefing has been useful. We have to be prepared. We have to know our enemies. We have to be having the right plan. That this plan has to be tested, has to be tried for us, to be prepared for an incident before an incident happens. With that, please excuse me for taking more time than expected. From me, Jamil, from my family, from my company, we thank all the heroes that have been protecting us in the healthcare sector. And I'm happy to take questions, if any, Karan, from your side.
In case if we have any questions, we'll let you know, and you can reach out to them directly. Unfortunately, we are running short of time, but that was a very interesting presentation. Thank you so much for that.
Thank you.
Yeah. Next up, we have a panel discussion on protecting the confidentiality, integrity, and availability of information. And it's going to be moderated by Dr. Shada Al-Salama. Over to you, Dr. Shada.
Thank you very much, Karan. This is really appreciated. And I'd like to thank you and the other organizers for this event, for the invitation and for the kind invitation and allowing me to speak to some distinguished panelists in our session today. Now, as we know, or let's say InfoSec experts know by heart and by training as well, that information systems cannot be secured without attaining the right balance between confidentiality, integrity, and availability. This is what we learn in books as experts in information security, and how hard it is to protect the information from unauthorized access, as well as while making it available and while maintaining the integrity of that information. Now, these are the fundamental basics that is easily said, but hard to maintain and to actually implement. Now, this challenge has been demonstrated by our speaker, Mr. Jamil, in his talk. This was a very good talk that demonstrates or landscapes the security threats during COVID time, specifically, where it added a lot of pressure and made it very valuable for the black market and attackers. Now, the flood of cybersecurity threats, and also, that is already been vulnerable, or let's say targeting different sectors, but it made healthcare sector specifically extremely vulnerable due to the circumstances of the pandemic, which made it very attractive to the attackers and to enrich the black market. There's opportunity always for money. So thank you very much, Mr. Jamil, for your great presentation. Before I go ahead and introduce our distinguished panelists to learn more about how to balance these information security goals, let's say, I would like to give the chance to introduce myself to the audience. My name is Dr. Shida As-Salama. I'm a consultant on full-time capacity with the Digital Health and Innovation Department at the World Health Organization in Geneva in Switzerland. And funny thing, I joined them 1 month right before the COVID hits. And that was very interesting. So I get to actually go and ride the wave with the WHO when it comes to the adoption of digital health and use it for COVID. I'm also a part-time consultant with the National Health Information Center at the Saudi Health Council in Riyadh, Saudi Arabia. I'm also, my let's say first job was actually being a faculty in King Saud University. I'm assistant professor of healthcare information system security at the College of Computer and Information Sciences at King Saud University in Riyadh. Now, on a daily basis, what I do is I bridge having the global and the local capacities, or let's say hats that I wear. I bridge the gap between the local and the global digital health needs and efforts. Now, let me please join me to give a warm welcome to our panelists to the virtual stage. We don't have a stage in such a virtual, let's say, platform. So let me start off by introducing our first panelist, Dr. Ahmed Al-Dammas, Executive Director, Cybersecurity and Risk at the Council of Cooperative Health Insurance. Welcome, Dr. Ahmed Al-Dammas. Let me introduce the rest of the panelists, and then we're going to give the chance for each and every one of them to properly introduce themselves better than anyone else. Second, our second panelist, Mr. Mohammed Siddiqui, Chief Information Officer, the International Medical Center. Welcome, Mr. Siddiqui. Last but not least, let us all welcome our last panelist, Mr. Mohammed Al-Khudari, CIO of Fakeeh Care in Jeddah. Welcome, Mr. Khudari. Welcome all, gentlemen. Now let's move to go back to Dr. Dammas, please, if you will go ahead and introduce yourself in a few minutes to the audience to give them a context of where you come from and your perspective, because we're going to learn from your experience in the next few minutes or the remaining time in this session. Please go ahead, Dr. Dammas.
Thank you very much, Dr. Shada. Thank you very much for the organizer for having me to participate with my little knowledge in this area about cybersecurity and the threats of the today digital transformation. I hold a PhD in computer science from King Saud University and Master of Business Administration, and Master also from University of Colorado of Boulder in computer science. I graduated from College of Computer Science in King Saud University, where I did my bachelor there. After that, I joined Lucent AT&T Technologies for 7 years during the telephone expansion 6 from 1996 to 2002. I joined, I think, Intisar with us here, worked with National Guard Health Affairs in King Khalid Hospital for 1 year. Then I joined, from that date, I joined the health sector, and now I'm leading the cybersecurity in Council of Cooperative Health Insurance, which is the regulator for health insurance. That is about 11 million people and about 5,000 health providers. So we oversees the transactions, the information that goes between those two entities and it is a huge data for hackers to get their hands on. Thank you, Dr. Shada.
Absolutely, absolutely. We're going to come back to this, and please just hold the thought, and we'll come back to this. We'll go next to Mr. Siddiqui. Please, if you can introduce yourself to give us perspective on, where you come from in terms of the expertise, to elaborate and allow the audience to ask you the right questions after the session or at the end of the session, please. Mr. Siddiqui.
Assalamu alaikum and Bismillahirrahmanirrahim. Thank you, Dr. Shada, for a great opportunity, and thanks for all the panelists. My name is Muhammad Siddiqui. I go by Muhammad. I've been working in healthcare for almost 23 plus a year experience in delivering the health systems and complex transformation project on globally, both in the US and Middle East. Currently, I'm working as a group chief information officer at International Medical Center. Those who don't know what the International Medical Center is, International Medical Center is a part of Mayo Clinic Care Network. So we work very closely with Mayo Clinic in the US, in Minnesota. I have master's in business administration from the US, the University of Phoenix in Chicago. I'm also a member of the Forbes Technology Group, also the media liaison for the College of Health Information Management Executive in the US, and a variety of different HIMSS committee that I also chaired as well. So welcome to you all, and looking forward to learning more from you all.
Thank you very much for being humble. We're learning from you today. Thank you very much. But absolutely, knowledge exchange is a very important thing in such events. And this is why it is very valuable to bring that to our audience. Last but not least, let's go to Mr. Al-Khudri. Please, if you can introduce yourself so we can start the session by asking the right questions and get you to tell us more from your experience. Please, over to you.
Thank you, Dr. Shada. Assalamu alaikum. I am Muhammad Salah Al-Khudri, a Master of Information Management System in Liverpool. I have a 20-year plus experience in the IT healthcare, and then currently I'm Fakeeh Care CIO in Jeddah.
Thank you very much. It's a pleasure to get to know you all, and it's a great pleasure for myself personally to moderate this session. Now, without further ado, let's actually try to paint the full picture and start with the first, let's say, theme of our talk. But before I go ahead and do that, let me just allow the audience to understand what is the aim of this session specifically. I'd like to allow the audience to gain a better clarity and understanding of where we are today in terms of information cybersecurity threats and the needs of information security and the challenges, and where we hope to be in the future, with an emphasis on the pandemic, since everyone is talking about it, and since we're actually at the middle of it, hopefully at the end of it, but definitely we're learning a lot, and there was a great impact from COVID. So I'm going to split the themes into three. One, to understand how the situation was pre-COVID, and then discuss the situation fast forward to today to see how the situation is, and then hoping to predict the future and where this is going to take us in terms of the threats and the efforts done locally. Thank you very much. Let's start off by trying to set the cybersecurity scene in terms of information security threats and challenges and needs pre-COVID, back in the normal times before the new norms of COVID-related environment. Let's start with Dr. Adamas, since he mentioned, about the insurance data. I know that the COVID had an impact, but let's talk about let's set the scene pre-COVID to understand how the, COVID has impacted the ecosystem from or added pressure on the cybersecurity challenges or needs in that term. Please, Dr. Damas, the floor is all yours.
Yes, Dr. Shada. The pre-COVID cybersecurity landscape was also intense, but the awareness of cybersecurity issues were normal. It was not very difficult to understand. People in the industry knows the surrounding status of the cybersecurity. However, Saudi Arabia anticipated the transformation with the Vision 2030, established the National Cybersecurity Authority in 2018. At that time, there were some incidents happened in 2017, in 2014 in Saudi Arabia, especially in health insurance companies, where some Shamir attacked some insurance companies, and the awareness start to become hot topic for capturing this data, where some companies lost months of files and health insurance policies. They couldn't go back to it. So with the introduction of 2018 National Cybersecurity Authority bylaws and the national cybersecurity controls, the momentum has risen to a higher level. Now, after a year and a half into that era, COVID came, and the attackers now, some of the previous work used to be manual to automated. During the pandemic, everybody went digital. Work from home went peak. Everybody's quarantined, and they has to do the work from home and transform everything to the digital transformation. These increased even the presence of physicians and patient online. So consultation becomes over the net, and this is also an increased risk to the, and an increased opportunity for the hackers, increased risk for the normal people.
If you don't mind, Ahmed, can I hold you at this stage? Because we need to elaborate on during COVID threats and how that transformed. If we can just hear from the other panelists about pre-COVID, and then please hold the thought. Again, I'll get back to you so we can see how things has changed since everything we were forced to move to the digital platform without any further notice, and we had to be ready for it. So please pardon me for just one more minute until we come back to this during COVID or amid COVID phase. I'll move on to our next panelist. Let's go ahead with Mr. Al-Khudari. Please, if you can elaborate to us from your perspective and understanding and knowledge how things have been before COVID, and if you can set the scene from your perspective. Mr. Al-Khudari, over to you.
Okay. Well, I agree with Dr. Al-Dammas regarding the awareness. Before pandemic, actually the awareness was growing, and the cyber attacks before pandemic was clearly on the risk radar. And the driver for this was the increasing dependency on the IT business and on data and IT systems. Regarding the challenges, I think the lack of experience regarding cybersecurity experts in the healthcare industry was one of the challenges, major challenges, and cybersecurity budget also in the healthcare industry also was one of the major challenges.
Thank you very much for that. Actually, what Dr. Dammas has mentioned about, how the government has reacted and responded to the increasing threats around 2017, when by establishing clearly that there was a need for an authority that is specified and to regulate in terms of information security and cyber security countermeasures, and to help institutes and government agencies to go ahead and build the fences and defend their systems. And thank you very much, Mr. Al-Khudari, about the highlight that you had. I'll move to our next panelist to shed light on that specific theme before we move on to amid COVID. Mr. Siddiqui, please.
Thank you so much. So I'll start with thanks for the great question. I'll start this scene before the COVID. We are CIOs throughout the world and probably in Kingdom stand up in front of the board and really pushing and fighting to get the budget approval. And was very hard, very challenging. This is the scene before the COVID. Number two, if you want to see what has changed in a market, and I know Mr. Aqil mentioned in very detail, the Middle East market for the information security around 16.1 billion around 2020, right? They are forecasting to be 28.7 billion by 2025. This was a prediction before COVID. Things have changed. I have a new number, but I think you have another question that you asked me what's changed. So things have changed as well. I agree with both Brother Muhammad and Dr. Ahmad as well. However, things can move forward much quicker. A lot of bureaucratic process has been removed. And I think that, like I said, COVID is obviously the curse for the world, but can be blessing for some of us to be able to get an approval to move forward things quickly.
Absolutely. So I don't think finances were an issue after COVID. Let's say that. Since the money, like Mr. Jamil has mentioned in his presentation, money was pouring into the healthcare system because we've seen tremendous and amazing effort of collaboration between the West and the East. Everyone was trying to help in this pandemic. And so the money was pouring from all over in order to help the healthcare systems rise. And that's, regarding the data, the research, the technical, infrastructure that it needed, all of that all in together. So I'll go back to Dr. Damas, and we're going to continue the thought around, how things change after moving or being forced to move to the digital sector, digital infrastructure, how things in terms of pressure and cybersecurity and threats. I know that a lot of people were actually, doing nothing during the lockdown and being quarantined and all of that. They had more time on their hands in order to try new threats and attacks and be able to master cybersecurity on very targeted, let's say, attractive targets. Let's go back to you, Dr. Damas, if you can please shed more light on fast forward a little bit and then to reach today and how things are in the digital ecosystem, please.
Who thought that someday you will have a virtual hospital? Last week, Ministry of Health announced that the introduction of a virtual hospital, which is, if you asked me 2 years ago in a questionnaire on a survey, would you appreciate, is it possible to have a virtual hospital? Now it became a reality. Okay, things are moved very fast during these 2 years of pandemics, where physicians now can treat patients through the way that we are discussing this this information, this talk today. However, the risk is still there. The medical file still needs to be protected, needs to be encrypted, needs to be available all the times. Physicians cannot work without having write the medical history of the patient and at the same time prescribe them with medications and record these and important notes on the medical files. So all of these medias are now moved to the internet, and the three themes you mentioned at the beginning of the availability, the confidentiality, and the integrity now exist in the whole of information health and information health care. So you need all the controls to protect the patient information, and in addition, you need to introduce a third or a fourth dimension, which is the privacy. No one should allow the interactions to be revealed. Everybody knows that patient information, patient and doctor confidentiality and privacy is top things between patient and doctor. It is a top confidential information. So these things add more burden on our on us, the individuals who help protecting these to protect the information in this area.
Thank you very much, Dr. Damas. This is very valuable information to me personally to learn from, and also for the audience to introduce in 2021, the very first virtual hospital home, where we can actually experience the great technology. I mean, during COVID, we have experienced a lot of technical exposure, let's say, and the utilization and harness of digital, or let's say, emerging technologies in order to help the individual even cope, let alone the healthcare providers and regulators. Thank you very much for this insight. Let me go to Mr. Siddiqui and go back to the figures. Now you mentioned 17 billion, was it? The target budget before COVID. Let's go ahead with the COVID, during COVID or post-COVID numbers that were, would like to hear more about that specifically. And please tell us how things are from your perspective in terms of, the situation today.
Sure. That's amazing. So from 20, so when they did the new forecasting based on an impact on a COVID, looks like we are hitting around 30 billion, and we're talking of only Middle East. That's the forecasting revenue we're talking about a market in the Middle East for the cybersecurity. And another fascinating number, the Kingdom of Saudi is hold the highest market during the forecasted period for this 2025. And I agree with Dr. Ahmed Amas, we're talking about virtual health is coming, hospital at home is coming. You are adding more and more vulnerability, not only to our businesses, because obviously our business has to be up and running. We cannot afford any disruption. At the same time, we disrupted the patient, how to perceive the service, where they receive it and how they want it, because now they are coming more and more consumer mindset. Technology advancement like 5G, IoT have led the SMEs to believe that these numbers may be surpassed by 10 to 15% more than 30 billion that I just talked about it as well there. So I think we are on a very fast speedway rail, 300 kilometers an hour. Things change overnight. However, COVID has given us a lesson to be ready all the time, not to wait for the last, and not to avoid any firefighting modes that we are dealing with every single day. Coming from the healthcare, especially in hospital, any breach of the cybersecurity attack in hospital on a clinical practice can impact the patient life, because we have some heart cardiology surgeries are happening in our OR room every single day. I know in our ICU, it's almost full today because of the COVID patient. God forbid, one break or ransomware attack hit us and locked down all our system. How are we going to prevent from happening this? So these things, I think we have to think through it, and this is the phase after the COVID. And I'm glad that the money is pouring into the cybersecurity now, which help us able to resolve some of those issues.
Absolutely. Thank you very much. This is really valuable information that you're providing. I remember meeting with some of the chief information security officers like a few years, maybe 3 years before COVID. And their struggle is to convince the chiefs, the C-level people about why they need to invest in security. I don't think that's their issue anymore. Thank you very much, Mr. Siddiqui, for that elaboration. I'll go back to Mr. Al-Khudari. Please, if you have any insights to add to our panelists' thoughts. Over to you.
Yes, regarding the healthcare sector, we are witnessing during pandemic a new reality actually, which is challenging our resilience, our business resilience. You can imagine that before pandemic, our perception regarding security is building walls surrounding our organization. And because of the new situation for the decreased mobility and border closure and the increased remote work, you have new needs now.
Thank you. Thank you very much. Mr. Al-Khudari, are you freezing or is this just my screen? Are we having a technical issue with Mr. Siddiqui, or that's just me? Can I get a confirmation, please, from the organizer?
I can hear you very well, loud and clear.
Okay, okay, so good, thank you. Someone is alive, okay.
All is well.
No worries. Maybe until we get back Mr. Al-Khudari back and live, maybe I can ask you, Mr. Siddiqui, if you don't mind. You mentioned slightly the role of people. And when I say people, I don't mean healthcare professionals, because they sacrifice their lives for us, and no one can talk anything or say, it's already been said and done. And also the healthcare providers in terms of the hospitals. I want to talk about the public, the people. What were their role? Whether to increase cybersecurity or decrease, or maybe what is the influence or the impact of the general, whether they were, patients, whether they were caregivers, whether they were random people who never actually needed to go to the healthcare system for vaccination or support. Tell me more about the people, just briefly, before we move to maybe finding Mr. Al-Khudari before we move to the next topic. Over to you.
Sure. So, I think as we talked about, the COVID have influenced every aspect of our life, right? Like I said, when I was talking to a couple of the folks about digital transformation in healthcare, I think that's fast track. I know some of the items that I'm working at today at International Medical Center, those items were supposed to be done in 2025, such as hospital at home. And Dr. Damaz has talked about the Ministry of Health already working on this very closely as well. So the perceive of receiving a service for healthcare, perfect example, when we were in crisis in COVID during the lockdown, patients don't want to come to the hospital. They like to receive a service where they are in their home, or maybe they're in a car. We established a telehealth capability in our hospital less than 12 days, to be honest with you. I still remember that 16 months ago, before the COVID, board was asking me how long it takes for us to set up the telemedicine services. And that time my answer was, hey, it's going to cost you some of the millions of real, and it's going to take us 7 to 8 months. Guess what? We up and running in 12 days with 400 physicians in our hospital. So I think this is the impact that really bring in by the COVID has done it for us as well. As a patient, as a public, absolutely. We wanted to make sure that our hospital is secure. I always said this to everybody, the data we have in hospital is owned by patients. It's not owned by the hospital, to be honest with you. So we are a custodian of this data. This is an amana to us from our patient. How can I protect the data for the patient? My hospital has been up and running for the last 16 years. I have terabytes and terabytes of data and thousands of the patient. Our job is how can we protect this? How can we build the trust for the people to make sure when they walked in, they're not going to get infected by a person? We have deployed thermal cameras, and we deployed this a very early stage. So person walked in, we are checking their fever before they enter into our building. So these kind of things, I think that's where the expectation from the public, from the hospital setup. What can you do for me? I'm your customer, right? The consumer mindset.
Thank you very much, Mr. Siddiqui. This is really a very good perspective, showing how much and the impact of the individuals. And this is a really great effort, and it's good to communicate that to us, because we really don't see the behind the scene. Yeah. We don't need to know about those details. So it's really great that we're learning from your experience and learning from that. Now, Mr. Al-Khudari is back online, and apologies for the hiccup, but we'll get back to him. Mr. Al-Khudari, it's over to you. We just want to listen to your idea, or let's say thoughts and response regarding, the cybersecurity. You mentioned the last word you use is a new need. So you stop there, and we would like you to continue your thoughts on that, please. Over to you.
So, continue this, our user now became outside the walls we built already regarding these new needs. So we was not prepared, actually. We have to move faster to achieve our business and for business continuity. But for cybersecurity perspective, we are not well prepared. So we found, we are hearing about a lot of threats during pandemic. We saw that there's a huge increase in the attacks. It reached 900% before pandemic, as we see the statistics. Cybersecurity experts report telling that 4,000 cyber attack a day since COVID-19 pandemic. We are terrified from these numbers, actually. Also, there's a lot of challenges we are facing. Also, the healthcare sector itself was overwhelmed to provide our role and basic service regarding saving patient life, which move our focus and instead of focusing on our security and so on, we are concentrating in our basic functions. So makes us vulnerable and under risk. Staff of the healthcare sector were not well trained to work from outside and not have the enough awareness regarding cybersecurity. Also, the increasing digital commerce, searching about our needs, makes us more vulnerable for these scams and phishing mails and so on. So this is my ideas regarding the challenges and the threats during pandemic.
Thank you very much, Mr. Al-Khudari. When you mentioned that one of the things that you had to focus on to give priority to is the regular operation, the business continuity, let's say, during this comment. But part of this, and this is one of the challenges of healthcare information system security, is that you need to make sure that the information is available to the doctor, because more harm is done to the patient if the information is not available than this information is actually falling into the wrong hands. So I believe that this is definitely the right priority for hospitals and healthcare providers because of the impact on the patient, because this is what the patient needs at the time of care. And believe me, if you ask them, they wouldn't care about their information spreading as much as you can actually take care of them. And part of the making the information available is with comorbidities. One of the challenges of COVID is that you need to check to provide a holistic care, because diabetes and heart diseases and other comorbidities and chronic diseases were impact on the decision making of doctors at the scene, and even during in emergencies. So it was very, very important to provide that information. For example, I always say this story when it comes to the use of technologies, and my father, Dr. Abdullah Salama, is my role model. He was infected with COVID and he kept being positive for 3 months, and that was in June last year. And it was at the early stages when we did not know much as caregivers at home. And also he had to go to the hospital several times. He's asthmatic. So we expected breathing to be the most difficult thing. You know what? Alhamdulillah, we were fortunate that he did not have any symptoms relevant to breathing, but he had a lot of problems with appetite, and we couldn't feed him at home. Don't know how to deal with and caregive, COVID patients. So we had to take him to the hospital in order to get an IV and get the right neutral, basics for him to keep going. He lost 10 kilograms during that time. So, and then he started receiving lots of infections, 3 infections in 3 months. That was a lot. And we did not know what was going on. Even doctors did not know what was going on, because we had to consider his case. So it's very complex already, letting alone, caring about information security and the attacks happening in the background that is actually very annoying and time consuming for experts. So I totally understand the challenges. This is just a small story coming from a family member who was there. Now, thank you for setting the scene for how things are today with COVID. Let us go and have a sneak peek into the future and see how you predict the future to be when it comes to cybersecurity. Let's go. Maybe we should continue our conversation with Mr. Al-Khudari. and see what he thinks about the future. Please give us some good news. We're happy to receive bad news, but just give us some good news about how you predict, or we want to be, or where you think we're going to move forward in terms of cybersecurity down the line, post-COVID, hopefully, inshallah. Over to you.
Okay, and I think one conversation with the chairman regarding conducting the meeting remotely. And I think he told me we will continue using the remote class. So already we are digitally transformed.
Yes.
Okay, and the transformation will grow and grow at home and in business. We will not stop. And having this digitalization, the risk also will continue. And also, the cyber crime is always taking a step forward, and we are chasing them. So we are expecting that they will evolve themselves. They will discover new techniques for attacks, and we will follow them to have a more comprehensive security and so on. Researchers estimate that the global cyber crime cost will reach $10.5 trillion annually by 2025.
A lot of numbers, very big numbers.
This is academic numbers, actually.
Yeah.
So cyber criminals are constantly developing innovative attacks to fit new trends, and modern IT infrastructure also becoming increasingly complex and so on.
Thank you very much. Thank you very much for that. Next to, maybe we can go to Dr. Damas. What any lessons learned from the insurance perspective, could be company perspective, and the the attacks happening, and what's going on with the new movement with the virtual hospital, and all of the good news about the investment coming from the government regarding the right of building or supporting the infrastructure. What do you think we have learned in terms of lessons for a better future, inshallah? Dr. Damas, over to you.
Yes, I think the future is bright. However, this cybersecurity issue will continue with us forever. Now it is a fact of life, and you will. It is part of moving forwards, moving digital, but you need to be vigilant, protect your information, be careful. The attackers or the infrastructures, there are three things that attackers can attack: either the people or the process or the technology. And the most important thing is the people, okay? Us, patients. Now, the medical files, now, I go to a hospital. The medical file now is in my iPhone. So all the labs tests, all the X-rays are now available with me on my iPhone. So usually the information for medical file now in the dark web is 5 times the credit card cost. So please, for the future, this is a fact of life. It is an easy of use. You can access your pharmacy clinics instantly without a lot of order, but you can access them on your phone. So this is an ease of life. However, it comes with it risk. So the future, you need on an individual level, be careful, vigilant to emails comes to you, phishing emails, a lot of things. And these are the messages that we would like to share with people on this conference. Be careful and spread the message of these things.
Absolutely. Thank you very much for that. Actually, you answered the last question. What would be a message that you would like to give to the people? And thank you very much for communicating. There is a lot of responsibility on the individuals, like Mr. Sadiqi mentioned. Where hospitals and healthcare providers and the regulators are only, let's say, providers are custodians of the data, but at the end of the day, it is your data as an individual, and you play a great role whether to help or to actually add a burden on healthcare providers when it comes to the data and management of it. So it is your responsibility, and there is a lot on your shoulder in terms of protecting your very own data. Thank you very much, Dr. Damas. We'll move to Dr. Sadiqi. What do you think about the, what we just mentioned about the future? How do you see the future happening? You gave us a lot of really big numbers, fat numbers. Maybe if you can just lower the tone a little bit to give us a bright, optimistic future.
Dr. Shada, I'm a very optimistic, to be honest with you. The attention that we were missing before the COVID, we finally got the attention, to be honest with you. It's also getting attention from our patients, not only the healers. I call our physician and frontline, they are the healers, right? And we in IT, we are healing the healers. That's exactly the term that I use all the time. I think the future, we have to be focused more on teleworking solution. I think that just having a VPN is not enough. We need to do more stronger, robust solution has to be work on this. We must have to have a proper identity and access management system to be in place, even for the remote worker. Who has access to what? We need to make sure that we have a complete deployment of the MDM solution, because most of our phone where you access your email and everything does not really have an MDM solution deployed by the corporate. Some of these things that we're working at IMC today. We need to make sure that we have a secure collaboration platform. Everybody and most of you already using a SharePoint, where we're sharing a lot of files, and there's a lot of patient data on those files. So we have to have a data classification, has to be done as well there. We all have to go back and refresh our cybersecurity policy and strategy, because things have changed. What is used to be in 2019, your roadmap, is not going to be applied in 2020, 2021 maybe, right? So we have to work on this as well. Same thing applied to bring your own device at work, has to have a policy. You just do not allow people to come and bring their laptop in your network to be infected network there. End of the day, we will not allow people to play the life of our patient. We are in healthcare. This is not an entertainment industry. We are here to care our patients. And I think the lesson learned for me for this whole pandemic preparation is the key to successful limit the risk related to the cyber attacks in the future. I think cybersecurity is not owned by the CIOs or CISOs. I think cybersecurity is owned by every single person who works in a healthcare sector, and patients should be the partner with that engagement as well.
Absolutely, because what that's exactly goes in line with Dr. Damas' response when he said, it's either the people, which is the weak link, because they contribute. It's an ecosystem, and in order to maintain that, you need to make sure all participants within that ecosystem are actually collaborating on maintaining that fence and wall. Can I ask maybe just to elaborate on what you said? When we say, the digital immigrants and the digital natives, people who were born, using technology and got used to it, and those who are actually getting to learn it throughout the years and maybe not as native in it as, the younger generation. In terms of the security, what advice would you give them, if you don't mind me asking you that, Mr. Sadiqi, just to elaborate on this, and then we're going to move to the final.
Sure. Thanks for asking me. Just to give you a two fascinating number, somebody just sent me the WhatsApp this morning. Usability of the mobile around 460% up in last 3 to 4 years. 460% up. The number is fascinating, right? TV, people stop watching TV, by the way. Minus 24% the TV rating. People don't even turn on the TV. They watch everything pretty much in their laptop, in a mobile. So this is the mindset we are into it, to be honest with you. There are people, I know I do have some patient who's age around 60 to 70%, 70 plus age, and they love to use our telehealth solution. But we do at the same time, we have a millennium, they don't want to use the telehealth. They like to have a tangible, physical conversation with our physician. So one side doesn't fit for all. I agree with you as well. I think we need to go out there and add more awareness to both our patients, and not only the patient, also our physicians, our staff, our frontliner, how to use it, what the right thing to do, what not right thing to do as well. And this is what I said previously, we have to refresh our strategy around this cybersecurity awareness, because your weakest link, your insider threat. 70% of the incident for ransomware is coming from internal, not from external.
Thank you very much. Actually, no pressure, audience. There's a lot that actually been said here that actually we're shifting the burden and the responsibility on your shoulders. And there's a lot that you need to be aware of. And, you know, this requires a lot of training coming from the people. And I know that SIDAIM, the Cybersecurity Authority, they all are trying their best to provide such training and say raise the awareness around the, you know, how the audience or the general person, whether native, digital, or it doesn't matter. Now, you know, in COVID, we're all had to deal with digital infrastructures, whether we like it or not. But there is a lot that we can learn from such leading authorities in the space of data and information security. Now, before we close the session, I would just want to go ahead with a very brief, let's say, takeaway message that each and every one of you would like to give to the audience. No pressure on the audience, but it's just, what is the message that you would like to convey to the audience and the takeaway message that they can take after the end of this session before we open the floor for any questions? Let's go to Mr. Al-Khudari. Would you like to give us any takeaway message that you would like to convey to the and communicate to the audience, please? You're muted, I'm sorry.
Yes, thank you.
Yeah.
My message is don't learn the lesson in the hard way. Everyone should be prepared in order to protect the availability of essential healthcare, and as well the confidentiality and integrity of the health information. You should consider cybersecurity capability as a strategic asset to be adopted. You should ensure your business continuity by securing an effective backup and restoration procedure, prepare your recovery plan, prepare your contingency plan, and make the people participate with you in this contingency plan. Make a lot of drills, make security risk assessments, cybersecurity insurance is very critical. Cybersecurity insurance during the pandemic. Manage your assets, manage your application, keep monitoring, apply technical control. A lot of tips I can give. Cybersecurity is very critical. Thank you very much.
Thank you very much, Mr. Al-Khudari. This is well appreciated. Over to Dr. Damas. Would you like to give any takeaway message to the audience?
I already mentioned my takeaway message. Don't be the weakest link, whether you are whether you are a professional cybersecurity in working in the health sector, whether you are a health practitioner, you are also a member of this ecosystem, or whether you are a patient or individual like me and Dr. Shada. And by the way, Dr. Shada, please pass my regards to your father. He is my dean and he is my godfather.
Thank you very much. I think he's a godfather for a lot of people, and I'm very proud of him. He taught me a lot, and I'm actually following in his footsteps. And a lot of the support coming is actually from him to be who I am today. Thank you very much, Dr. Damas. I'll pass that on. Thank you for your kindness and loyalty. Last but not least, Mr. Siddiqui, take away message, please.
Absolutely. Thank you so much. So COVID-19 will change our life forever. With new work style, new cybersecurity issues, new proposed policy, personal hygiene, and so on. And as far as we know, the digital transformation is coming, is already here. Disruption is not coming from because of the technology. Disruption is coming from the people. So we need to be ready for this. So my takeaway for all my audience is increase security risk from remote working and learning and enhance that work. Cybersecurity and work on a business continuity. You have to have a plan to be ready. You don't want to be in a firefighting mode when there's something happened to you. Over to you.
Thank you very much. This is really appreciated. Thank you very much. We have learned a lot. Me personally, I really enjoyed this panel discussion, and I learned a lot from this distinguished panelists, learning from their experience about actually how the basic needs maintained during the COVID. Medical records, keeping information available to the right person whenever needed. And when I say availability, you know, for everything that is relevant to his role to make an informed decision, and also maintaining the confidentiality and integrity of that information while doing so, is still the basic need that did not change during COVID. But yet, new needs has emerged based on the shift to the new platform and also the challenges that came along with them. Thank you very much, Mr. As-Siddiqui. Thank you very much, Mr. Al-Khudari. Thank you very much, Dr. Ad-Dammas, for your valuable insights and information. Please, everyone in the audience, please join me in thanking our panelists for sharing their experiences and thoughts on such data challenges and needs pre, amid, and post-COVID. Thank you very much. And now we're open the floor for any questions or feedback, or maybe I'll turn it over to Karan to tell us whether we have time for questions. We're just 2 minutes ahead of time. Running late. And I'm not sure if we have time for questions or we should move on to the next session. Over to you, Karan.
Thank you, Dr. Shada, and all the panelists. Yes, we do have time for questions. In fact, we have 2 questions. It's there on the chat. Would you like me to read them out, or would you like to read it?
I see one question. Can you read them out? And then maybe I'll moderate.
Okay. So the first one is, what are the cybersecurity standards or frameworks adopted, implemented, or followed by the healthcare industry in Saudi Arabia, as applicable to large providers like Fakeeh, IMC, etc.?
Thank you very much for this question. Before you go to, can we take the next one as well?
Yes, the next one is there any update on the data privacy laws in Saudi Arabia from the Saudi Authority for Data and Artificial Intelligence?
Okay, so these are questions directed to our panelists. I'll leave the floor to them. Who would like to answer either of them, or maybe both? Maybe since they mentioned Fakeeh and the standards, maybe we can hear from Mr. Al-Khudari, no pressure. But if you maybe can give us, answer the Maqsood Ahmed's question regarding the standards.
Okay, so you have such compliance with security frameworks, one or more is very important. In Saudi Arabia, we have here NCA, which National Security Association. Okay, which most of the controls similar to ISO also. So if you have NCA and beside NCA you take another compliance like NIST or ISO, it will be good.
Thank you very much. Anyone having any comments that would like?
I am.
Go ahead.
I am heading the committee for implementing the national cybersecurity controls in the private sector, which is Mr. Khudari mentioned. This is also applicable to all hospitals, all pharmacies. We have distributed a month, maybe 2 weeks ago, that to work in insurance, you need to comply with the regulations of the cybersecurity. And in future, audit teams will go to these hospitals and measure their compliance to the authorities. The other thing is about the data privacy. I think that is already mentioned in the NDMO, the National Data Office. There is a drafted data classification and data governance protocols on regulations, and it is their era that will be implemented. However, the privacy and cybersecurity is working very closely to each other, and I think something will come up very soon.
Thank you very much for answering that question. Mr. Siddiqui, do you have anything to add? No pressure.
Oh, I agree with Brother Muhammad from Fakeeh as well. So at IMC, I think somebody asked what we're doing at IMC. So International Medical Center, we are doing very similar. We follow the NCA, also the NISA from the US, and also the ISO 27001. This is the framework that we're using to protect our control. We are also working very, very closely with our CCHI from Dr. Ahmad's organization for the NAFIS implementation. And this is the controls we have in place with them as well.
Thank you very much. Thank you for that. Thank you for answering. Karan, do we have time to answer the last posted question, or shall we move to the next session?
Yes, we have one more question. We can take that and then we'll move to the next session.
Oh, absolutely. So I'll read it out loud, and please, any of the panelists, we would appreciate if you can provide an answer to that specific question. So the questions read: how confident would healthcare providers feel protected towards future cyber attacks in comparison to the region and the world at large? So that is the question. I'll repeat it. How confident would healthcare providers feel protected towards future cyber attacks in comparison to the region and the world? That's a tough question to ask. But
let me take it. Let me challenge myself. Let me challenge myself. Okay. No one is confident. No one is confident 100%. The question is how much secure your organization. You could be at lower risk or higher risk. This is the question to answer you. You need to implement these controls, ISO, NIST, the Cybersecurity Authority controls, in order for you to be at the position of confidence that you are saying, okay, I am 85% confidence that if I did these controls, I can protect encryption for the patient information, encryption for the credit cards. But the question is, this is the way I can see the answer to it, is I want to be in an area where I am high secure hospital in terms of cybersecurity and information security.
Thank you very much. Thank you. Any other thoughts from anyone? I mean, I really enjoyed this panel discussion. It's like sitting in a coffee shop back in the days, talking to experts, casually about, how threats and how things are going in terms of cybersecurity. Thank you. I would like to thank Dr. Ahmed Damas again, Mr. Siddiqui and Mr. Al-Khudri for their valuable knowledge and expertise that actually they communicated in a very short session. And I wish that we had more time to ask you more questions, but I know that we have other panelists who are actually having some other knowledge and in relation to cyber attacks that we look forward to hearing from them. Thank you very much all. I really appreciate it, and I look forward to seeing you in the future. Thank you.
Thank you.
Thank you. Thank you very much. Thank you. Over to you, Karan.
Thank you so much, everyone. This was a very insightful panel, and thank you for improving the cybersecurity system, cybersecurity in the healthcare industry. Next up, we have a panel discussion on cyber attacks in the healthcare industry, moderated by Engineer Afaf Ali Al-Zarhani. Over to you, Engineer Afaf.
Hello, everyone. Good afternoon. I'd like to thank the previous discussion, Mr. Ahmed Siddiqui and Dr. Shahad Al-Salama, also Mr. Ahmed Al-Dammas, and Mr. Muhammad Al-Khudri. Thank you very much for a very interesting discussion. And the second part of this discussion will be my speaker, Mrs. Intisar Abdullah, Director of Health and Information Management at Ministry of National Guard Health Affairs. Also, we will have Dr. Dalshid, CEO and President at Makkah Healthcare Cluster. Also, we'll have Engineer Ahmed Safi, IT Manager at Aster Sanad. So this discussion will have three parts. First, we'll have talk with Mrs. Intisar Abdullah. So she can start now by introduce herself and give us very information about that discussion. Welcome, Mr. Intisar, Mrs. Intisar, and you can start now.
Assalamu alaikum. Thank you very much for hosting me in this talk or conference or summit, we can call it. So delightful to be part of this discussion, and I have really enjoyed the previous discussions. It was really very wealthy with knowledge. To introduce myself, I'm Intisar Abdullah, Director of Health Information Management in King Abdulaziz Medical City in Jeddah, under the National Guard Health Affairs, Ministry of National Guard Health Affairs. I have more than 30 years experience in healthcare and especially in health information management. I have 2 bachelor degrees. One is in English literature from King Abdulaziz University in Jeddah. And my other degree is in health information management from Regis University in Denver, Colorado. I also have a master's degree in health service administration from Denver, Colorado. I also have the credentials from the American Health Information Management Association as a registered health information management administrator. I have really participated and shared so many activities within the hospital, within the Ministry of National Guard Health Affairs, and within our national activities or committees or summits. I have been speakers in the quality medical record practice for the Saudi Quality Council. I developed a chapter of management of information and medical records for the Central Board Accreditation. This is more or less a short summary about me, and the floor is back to you, Afaf.
Thank you very much, and I am very happy to be a part of this discussion. So we'll start with a few questions that I would like to ask you. The first question is, what are the security concerns healthcare organizations are facing?
First of all, let us define cybersecurity, because I really would like to. I've seen so many audience, maybe cybersecurity is not of their concern, or they don't know really what cybersecurity, they just hear about it. As we know, cybersecurity is the practice of defending computers, networks, servers, mobile devices from malicious attacks. And it's really now the era for it. We are on the era of digitization, and our country is one of the, I would say, advanced countries of adapting the digitization. Most of our sectors have been really computerized and using the digitalization. So because of that, not just the healthcare, we have the Ministry of Interior sectors, we have the banking, we have schools, especially with the virtual teaching and using of data. So we have so many concerns, or we will be actually prone to so many issues and attacks, such as this type of cybersecurity attacks. I would just want to say, I refer to the Department of Health and Human Services. They have observed that USA system have lost over $62 billion on dollars as a result of data breaches in 2016. And they have said there is 4 out of physicians have experienced some form of data breaching or cyber attacks. So we are maybe going to face, and I've heard from my other colleagues of some of the breaches happened and some of the security concerns with our insurance council.
Thank you very much. Yes, I have 2 more questions for you. Can you please share with us some cases of national, international with security attacks, please?
With regard to some cases, I have really researched about 3 cases, but I really want to speak a little bit of the type of cyber attacks. You know, there is the man in the middle attacks, there is the drive-by attacks, there is phishing and spear phishing, there is password attacks, and there is eavesdropping attacks, SQL injections. So one of the stories I want to share, it was in hospital across USA. It was Hollywood Presbyterian Hospital in California. It was one of the hospitals affected in case which delayed patient care and resulted in around 17,000 to regain access. There was some ransoms, some attackers have hijacked their information without doing anything, just because their network security wouldn't really doing the backups. And in order for them to gain that access, they had to pay 17,000, which is really not that much, but that's something affected most hospitals and most users of that healthcare from accessing their treatments, to read their results, to see their appointments, and they ask for ransomware so they really made pressure on that hospital to start going back and provide the care to their customers. Another one actually, which had a big hit, was in Boston, actually, Children's Hospital. That was really in 2014. There was really a known hacktivist group. They targeted that hospital because there was a case of a 14 years old girl. She was admitted as ward of the state, as the state took the custody or the guardianship from her parents, because they saw, or they thought that her parents were putting that child going under so many unnecessary treatment while the child has some psychological disorder. So those activists had thought this is a breach of the child confidentiality, and they start attacking that hospital systems, and they did that distributed denial access, and so many people couldn't, and they had to pay around $300,000 in responding to and justify the damage that attackers had done to their hospital. A third scenario or a third case happened. It was on one of the hospitals, also in a medical practice. Somebody have fraudulent the authentication of the CEO, and they have sent a request to a company to order a medication that worth of $500,000. And what just made that staff just to double check, because there was some form of address, it was really not the same. So he called to check, and then they discovered that was one of the cybersecurity attacks that hospital or that medical center would have paid $500,000 just of ordering and wiring that money to not the right company or not the right people. This is, in short, some of the breaches or some of the cybersecurity attacks. Thanks, Abba.
Thank you very much. Yeah, the last question, it is, what are the best practices for cybersecurity from your perspective?
With regard to cyber security practices, you've seen our previous panelists, they have talked about some, but in general, we need to have medical device security. We need to ensure our cybersecurity policies are written well and adhere to all the standards that is released and passed by either internationally or nationally. We need to have endpoint protection systems. We need also to have always an incident reports. We need to have a network and vulnerability and access management. We need to send email protection system. We need to do an awareness to the staff. Do not open any attachment without really ensuring that it is legitimate. Do not use your personal item and business on your work, because you are going to jeopardize your hospital and your healthcare, and you can be a victim to that. Also, the data protection and loss prevention, we need to ensure that we have this kind of measures. We have to use the encryption. Luckily, in my organization as a National Guard, and you know, our organizational of National Guard, they are really pro the technology, and they have the highest support from the upper management. We have hosted the Riyadh Global Digital Health Summit last August 2020, and just 2 weeks ago, they have released and announced that they have passed the ISO and IC 20,000 and 27,001. So we were granted that certificate. So there has to be many practices. Also, you have to be careful from the internal intruders. You might be a victim of an internal staff. They will do you the breach. So you need to ensure to have that in place. This is just in short, and maybe my other colleagues can add to these best practices of cybersecurity.
Thank you very much. I would like to thank you for giving me this chance to be a part of this amazing discussion. And if you can add more information from your side before I move to the next speaker.
Actually, I would just say that the message we are trying to say here, and with cybersecurity concerns, do not be a victim of it. You yourself, we have experience of so many friends, relatives that had been, their information have been hijacked, their WhatsApp was hijacked, their banking. So we really need to ensure that we do safe practice of how we use our mobiles, how we use our desktops, laptops, etc. How to be concerned and careful and cautious in our hospital, that we really need to be really cautious. And as I am a health information management director, and privacy and confidentiality and safety, it's one of the tasks I'm responsible about. I would really advise so many of the audience or the students that they need to ensure that they do get that certification of healthcare privacy and security from the American Health Information Management Association, because it really teach them the right standards about how to ensure your department, your hospital, your organization is safe. Another thing I would say that please make sure that teach the new generation that cybersecurity is a promising field now, and we need to. Although it's a little bit hard, but we need it. There is a big demand for needs, and I will advise also hospitals to start looking into creating such positions and titles of privacy and security officers in their hospitals, because the time has come now with this digitization era. It was also needed with the paper, but now the need for it it's more. Thank you.
Thank you very much, Mrs. Intisar Abdullah, Director of Health Information Management at Ministry of National Guard Health Affairs. Thank you very much for your time and giving us valuable information. Now I will move to Dr. Dalshid. He's the CEO and President of Makkah Healthcare Cluster.
Engineer Afaf, unfortunately, he will not be joining since he has an urgent emergency meeting. So you can continue with Mr. Ahmed Safi.
Yes, okay, we'll move to Mr. Engineer Ahmed Safi, IT Manager at Aster Sanad, if he with us. Hello, Mr. Ahmed, how are you? I think you are on mute, Mr. Ahmed.
Yeah, I was on mute. Sorry for that. Yeah, thank you for having me in this panel discussion. I'm really happy to join this expert people here in this discussion. So I'll start introducing myself and our organization. So my name is Ahmed Safi. I'm IT Manager at Aster Sanad Hospital here in Riyadh. We are part of Aster DM Healthcare Group based in UAE, and we are part of more than 25 hospitals and 200 clinic and pharmacy also across the geographic, India, GCC, and Jordan as well. I have bachelor degree in computer science and some security courses.
Okay. Yeah, I would like Engineer Ahmed to ask you a few questions related to today's discussion, cyber attacks. First one, how would you protect your organization from cyber attacks?
Yeah, protecting the organization is very crucial, and there is many things we can follow to protect ourselves. As the expert people just said in the previous panel, that the weakest cycle is the people. So I do believe that we have to focus on people at first by establishing a security culture in the organization, by keep ongoing training. And I think the ongoing training is the key word to prevent the people, because we cannot say that we are 100% protected from the technology perspective or point of view only. So there is a dependency on the people and the human resource, because they are important and responsible for that. How we can just keep these people, they have a good security culture. I believe we have to teach them the best practice in computer habits, how to deal with the operating system, how to work with the email, how to identify the phishing mails, and so on. So tips on the computers. Also, we have to teach them how to use strong passwords. Password is the most things that hackers are using to breach the data in any organization. There is 4 tips, I believe each one should know about it. I believe the first thing, the password should be unique, easy to remember, complex, and difficult to guess. These 4 things, it's very important to have a strong password and difficult for the hackers to hack it. The second thing, from my point of view, the technology part is also important here. We have, as you know, there is many parties now connected to the healthcare provider. Now hospitals are connected to the insurance companies, connected to the CCHI through many portals, and the data is open to many organizations. So for that, we should have firewalls in place, that should active firewalls in place to monitor the traffic between these 2 parties or any parties from the hospital or any organization. Also, the antivirus. Antivirus software is very important. It's very, very important. And not only simply install an antivirus, it should be always updated. As you know, there's every day there is new vulnerability, there is new batches update. So for that, you should have an updated antivirus in place to protect you from the technology perspective plus the people. The third thing from my perspective, I just stop at 5. The plan unexpected. Unexpected because we don't know what hackers are planning to do and what they're targeting and when they will target. So for that, we have to keep ourselves ready, because we don't know when the hacker will hack us. So for that, I believe we should have a backup solution and DRP plan on place as usual, ready every time. In case of any breach happen, then we can restore the data as soon as we can, to keep the work continuity also, because at the end we are in operation and we are helping patient to get healed. The 4th thing is the control access. Controlling access, it has two aspects in my opinion. Control access, usually the IT people will grant a user access to any new employee, and they will deactivate it once the employee is leaving. But the problem is, if there is any user shifted or moved from job role to another job role, usually the IT people will forget to change the access and the access management as per the new role. So this is one of the vulnerabilities, and people should be aware of it, because the data can be breached from inside, not only from outside, from the hackers. So this is one of the very important things. Also, in the access side, there is a physical access. Physical access is very important. Like you don't know if somebody stole the hardware, the device from your organization, and he went out, that's the data breach. So that is very important to have a physical access on that. And not only that, I'll tell you here a story happened. I know one of the international airports, they have a data center, and during the heavy rain, the water will leak from the ceiling into the data center. So the IT people will go and cover the servers with plastic bags to prevent this kind of unwelcome access from outside. So the physical access is not only for humans, for others, other things also. Like I said, the rains or unauthorized people to go inside. So this is very important to be protected from the hacking outside. The last thing is the limited access to the network. That's very important. Now, as you know, everyone is connected to outside, and we don't want anyone to access our network and just be a guest inside our network. So it's very important to have the policy and procedures in place on the network level. So maybe this is the top 5 things we can keep to keep us protected.
Question: who will do this?
Yeah, good question. Yeah, who will do this? This kind of combination, there's many things can be controlled, not only by IT people, the technology people. I believe that it should have a combination between 2 major players: cybersecurity engineers and healthcare informatics specialists. These 2 roles should have a strong combination to build a strong security system in order to stop the breach from outside, either by implementing technology or putting procedures in place. These people should be highly educated. They know the computer technology, security technology, and the healthcare needed and information.
Yeah, thank you very much. And the last question is, how we can, what's the important thing to have for better security?
Yeah.
Or what we should focus on for better?
Yes. Luckily, in the previous panel discussion, the expert was telling about the 3 things. I do agree with them that these 3 aspects it must be implemented in any organization. The confidentiality, it should be there and protected. Integrity also, and availability. If we implement these 3 factors in any organization, I believe we will have a high level of risk protection from hackers, either from inside or outside the organization. Yeah.
So thank you very much. I would like again to thank Mrs. Intisar Abdullah and Mr. Ahmed. And if you can add more advice or something before we go to questions.
I actually want to elaborate more on the previous of our previous panelists. They were talking about the data breaches from healthcare. It's higher than any other sector. Actually, when I was researching for my topic here, I came on to a report from the Soliman Institute and FireEye Data investigation report. Why healthcare industry has the higher reports? It's because it's mandated and obligated to report any data breaches by HIPAA, the Health Insurance and Probability and Accountability Act. Unlike the other sectors, they don't really need to report that. So just maybe if we had the same reporting, maybe we would have the same kind of breaches percentages wise. So this is just something I wanted just to elaborate for the previous sessions. So there was some bias on these figures and statistics. Also, one of the things which is more valuable to the hackers, to those actors, your personal health information or your other personal identifiable information, such as your credit cards or your other accounts. To them, it's your personal health information because your surgeries is your surgeries, your diseases is your diseases, so they can really use it for the frauds or for blackmailing. But the credit cards, they do tend to change. And also when you encounter any stealing or any concern or issue, you will report and then you will cancel your card. So it's more valuable to them is the PHI than the PII. Thanks, Hafaf.
Thank you very much. I guess, Mr. Karen, we have done from the discussion. If you want to ask more questions, please.
We have one question on how can digital transformation help in cybersecurity? If Mr. Ahmed Safi or Ms. Intisar Abdullah would like to take that.
Yeah,
Repeat the question.
How can digital transformation help in cybersecurity?
Yeah, if you don't mind, I'll just take this. Actually, from being after the pandemic, now we are moving to digital transformation. And before the pandemic, no one was taking care of the cybersecurity in healthcare due to the budget limitation and financial limitations. So now after COVID and the fact that we are moving to the digital transformation, and as Dr. Ahmed mentioned, that virtual hospitals, that will improve the techniques and technologies in the cybersecurity and implementation in each organization. So I don't know if Dr. Intisar will add something.
Actually, I do agree with you. However, I'm seeing now, maybe with patients are not coming physically, it would reduce some of the financial impact of the organization that might be divert to more spending on cybersecurity systems, softwares, hiring more staff with regard to cybersecurity knowledge and expertise. This is how really I can see it.
Mr. Karen, do you have any other question, please?
We don't have any more questions from the audience. In case they reach out to us, we will reach out to the speakers personally and we will share the question.
I have a question. أول شيء ودي بمسي بالخير على انتصار زميلتي في الحرس. كيف الحال؟ عساك طيبة؟
هلا أحمد، والله سعدت، ولو ما ذكرت إنك أنت اشتغلت في الحرس كنت زعلت.
طيب, we would like to know breaches from your area. Does it happen from your hospitals, or also no one is talking about? Intisar and Ahmed.
Okay, honestly speaking, this kind of things is very sensitive really in our country. Yes. We will not come and say we had a breach. It has to be really released by an authorities. But frankly speaking, I haven't really seen any outside breach. Maybe it was some internal breaches, but already the right measures were taken upon those people. Viewed or their other colleagues' private information. They did not maintain their confidentiality. But as external or as outside, I haven't really read or seen in any hospital in Saudi Arabia this kind of thing have been reported. And I was really amazed to see you reporting something about the insurance that some of their data was hijacked and being corrupted. So, that's really my answer. If I do have seen, if I have read, I would really share it with everybody. But I know internally there must be. We are human beings, and people tend really to be curious, know about their colleagues' informations. But there should be always measures, security measures in place, and disciplinary actions also in the place. And we do have that.
I totally agree with you. This is very sensitive information in terms of health privacy because it will damage the reputation. Number two, it happened. I'm sure it happens because I know it happened, okay? Number two, even in the banking industry, it happened, okay? No one can say we are not attacked, never, and it will never happen. Twitter attacked, Microsoft attacked, Facebook attacked, Google attacked. So who's in the world that we can say we are protected? However, with the new regulations, with the new controls, we want to be more secure. And if, God forbid, an attack happened, we want to be in business continuity as usual and move forward seamlessly. And if you took all the measures, encrypt your data, and I think we are in a good shape. All the best. I just stayed here to say hello.
Actually, I want to add to you, Ahmed, two funny things. You know, with these new rules and regulations, I think the most are happy are husbands, because when they saw the punishments for viewing your partner information, you'll be penalized for it. The other one, I will share a personal thing happened to me. Actually, I ruined a surprise from my daughter. In Mother's Day, I received a call, and because I'm so cautious with security and or stealing thefts and your identity, I rejected that call, and I did not allow that person to give me that gift from my daughter. And I came home and I found my daughter fighting with that company why my gift did not reach my mother. And then she heard me talking on the other room that somebody was trying to steal my information. She said, oh, it was you. So it's not the company's fault, it was you. So we become really obsessed now with when to trust a call and when to open a message. And it's become really overwhelming, really overwhelming.
Yes, this is the consideration. Thank you.
Thank you.
We have one more question. Which standards widely used in the pharma industry to secure IT and control system?
Maybe Mr. Ahmed will answer that. I'm not in the IT area, actually.
Come again, Karan?
What standards are widely used in the pharma industry to secure IT and control systems?
Look, there is no one standard that we can say that we should follow it. There is many standards can be followed. Here, in Saudi Arabia, we can follow the national regulation for the security. We can also, let's say, adopt the HIPAA compliance and ISO compliance. That's many standards can be integrated together to have a secure, let's say, to certain level, secure infrastructure and secure data inside any organization. But we cannot say there is a specific standard you can follow it and to be secure on that. Hope this answered the question, Karen.
That's perfect. Okay. So we are at the end of the session. So we can conclude the panel right now. So thank you so much, everyone, for your time. Thank you, everyone, for joining. We all enjoyed the sessions and the presentation and the panel discussions. So thank you, everyone, once again. And we have the next edition for Cyber Warriors Conclave on the 25th of August, which is for the Qatar edition. We'll keep everyone posted about that. Thank you, everyone.
Thank you, everyone.
Thank you
very much.
Thank you.
Thank you so much.